Imagine a symphony orchestra where each instrument, each note plays a crucial role. In the world of healthcare, drugs are these notes, creating a harmonious melody of wellness. But what happens when some notes go silent? When a drug becomes unavailable, it's akin to a violin string snapping mid-performance. This is the discordant reality of drug shortages. It's a complex issue with roots in manufacturing hiccups, supply chain vulnerabilities, and unexpected spikes in demand. And like a symphony facing a missing instrument, the healthcare system must adapt and overcome. Over the next quarter of an hour, we'll explore the causes of these shortages, the impact they have on healthcare, and the concerted efforts being made to keep the music playing. From the backstage role of the FDA to the legislative concert tours of Congress, we'll see how everyone has a part to play. Join us in this symphony as we delve into the cacophony of drug shortages. Just like a band missing its drummer, manufacturing issues can throw the entire pharmaceutical industry off beat. Imagine if the rhythm of your favorite song was suddenly disrupted, causing the melody to falter. That's what happens when quality control problems and production delays strike the pharmaceutical manufacturing process. These issues are similar to a drummer being unable to keep time, leading to an entire orchestra losing its rhythm. And just as a band cannot play without a venue, the pharmaceutical industry relies on a limited number of manufacturers. Picture a city with only a few music venues. If one of those venues shuts down, the impact on the music scene would be significant. Similarly, if a pharmaceutical manufacturer encounters problems, the effects ripple through the entire industry, creating a discord that reverberates globally. But what happens when these venues or manufacturers are not only limited but also monopolized? Well, the music scene would lack variety and competition, leading to stagnation and vulnerability. This is the same for the pharmaceutical industry. When a few manufacturers dominate the production of certain drugs, any disruption in their operations can lead to significant drug shortages. This discord in manufacturing is just the first note in the complex composition of drug shortages. And as with any symphony, every note, every beat matters. A single discord can disrupt the harmony, creating a ripple effect that impacts us all. Imagine if the strings for your guitar were made exclusively in Antarctica. Sounds absurd, right? But that's the stark reality of our pharmaceutical supply chain. Let's unpack this peculiar analogy to understand the situation better. Pharmaceutical manufacturing is an intricate global ballet. The dance begins with the sourcing of raw materials, pirouettes through multiple stages of production, and ends with the final product landing in our local pharmacies. Now consider this. Around 80% of active pharmaceutical ingredient facilities are located outside the United States. This means that a significant part of our medicinal chords are being strummed in foreign lands. What happens when there's a hiccup in this global performance? Perhaps a delay in raw material delivery, a manufacturing issue, or a logistics bottleneck. Well, it's akin to our Antarctic guitar strings getting delayed due to a snowstorm. The result is a discordant note in our healthcare symphony. A drug shortage. The global nature of pharmaceutical manufacturing has its advantages. It allows for cost-effectiveness, access to diverse resources, and worldwide distribution. However, it also amplifies the risk of interruptions. If one key player in the supply chain misses a beat, the whole performance can falter. In essence, the pharmaceutical industry is a global orchestra with many solo acts. Each player has a crucial role, and a misstep from even one can disrupt the entire concert. It's clear that the solo acts in the supply chain can lead to a jarring performance in the pharmaceutical industry. Sudden demand for a specific drug is like a surprise hit song at a concert. Imagine a band playing on stage. The crowd is enjoying the set, and then suddenly everyone starts shouting for a song that the band didn't rehearse. That's what happens in the pharmaceutical industry when there's an unexpected surge in demand for a particular drug. Take Adderall, for example. It's a drug used to treat attention deficit hyperactivity disorder, or ADHD. But in the mid-2000s, its demand skyrocketed, causing shortages that sent shockwaves through the healthcare system. Healthcare providers were left scrambling, trying to find alternative treatments for their patients, much like a band searching for the right chords to play an unplanned encore. This unpredictability is one of the biggest challenges in dealing with drug shortages. It's hard to prepare for a hit you didn't see coming. These unexpected encores in the pharmaceutical world can leave us scrambling for solutions. Behind every great concert, there's a roadie making sure everything runs smoothly. In the world of drug shortages, the Food and Drug Administration, or the FDA, plays this crucial role. Just like a roadie, the FDA ensures that every instrument in our healthcare symphony, each medication, is tuned and ready to play its part. The FDA has a number of strategies to prevent and mitigate drug shortages. One of their key roles is to monitor the pharmaceutical industry, keeping an eye on the supply chain and identifying potential shortages before they become a problem. They're like the sound techs at a concert, constantly adjusting levels to ensure the music plays on without a hitch. When a drug shortage does occur, the FDA jumps into action. They work with manufacturers to resolve the issue or find alternative sources for the drug in question. It's like when a guitar string snaps mid-concert. The roadie is there with a replacement, ready to get the show back on track. The FDA also has the authority to fast-track certain processes. For instance, they can expedite the review of new drug applications or approve changes to existing manufacturing sites or processes. This is akin to a roadie setting up a replacement instrument mid-show to keep the music flowing. Moreover, the FDA issues guidelines to manufacturers, advising them on best practices to prevent shortages. They're like the stage manager, offering guidance to the band to ensure the performance goes smoothly. The FDA's role goes beyond merely reacting to drug shortages. They're proactive, working to prevent shortages from occurring in the first place. It's like ensuring that the band is practiced and is ready to play so the audience, in this case patients and healthcare providers, can enjoy the concert without interruption. In essence, the FDA is the unsung hero in the fight against drug shortages. Their Backstage pass allows them to navigate the complex world of pharmaceutical manufacturing, ensuring each instrument plays its part in the healthcare symphony. The FDA's Backstage pass ensures that the show goes on even in the face of drug shortages. Just as a successful world tour needs careful planning, so too does our fight against drug shortages. Imagine a world tour. It's a massive undertaking, a symphony of logistics and coordination. There are venues to book, promotional materials to distribute, and a million little details to iron out. Now, imagine that instead of a band, we're talking about the pharmaceutical industry, and instead of concerts, we're talking about effective healthcare delivery. This is where our legislative maestros step in, conducting the orchestra of drug supply with strategic measures. One such legislative effort is the Mapping America's Pharmaceutical Supply Act. This act is like the tour manager, meticulously plotting out each stop on the tour, ensuring that every venue, in this case pharmacies and hospitals, is prepared for the show. This act aims to bring transparency to the pharmaceutical supply chain. It requires the Department of Health and Human Services to map the locations of pharmaceutical manufacturers, their suppliers, and the sources of active pharmaceutical ingredients. It's all about knowing where our band members are and making sure they're ready to play their part in the grand concert of healthcare. But that's not all. There are other bills in the works too. The Mitigating Emergency Drug Shortages Act, or MEDS Act for short, is another key player. It works like a seasoned roadie, ensuring that the show can go on even when unforeseen circumstances occur. The MEDS Act mandates manufacturers to have contingency plans in place to prevent drug shortages in case of disruptions. These legislative concert tours are not just about preventing drug shortages, they're about ensuring that the healthcare system, like a well-planned concert, runs smoothly and efficiently. They're about making sure that when you walk into a pharmacy or a hospital, the medicine you need is there, ready and waiting, just like your favorite band hitting the stage right on cue. These legislative concert tours aim to keep the melody of healthcare flowing smoothly across the nation. When a DJ has to abruptly switch tracks, it disrupts the dance floor. Similarly, drug shortages disrupt the rhythm of healthcare. It's a sudden change in tempo that can leave patients and healthcare providers scrambling to keep up with the beat. Let's imagine for a moment you're a healthcare provider, a maestro conducting the delicate symphony of patient care. You've carefully chosen the right composition, the best medication for your patient's condition, Suddenly, you're told that this medication is not available. The music stops. You're left scrambling to find an alternative, a different tune that may not fit quite as well into your patient's unique symphony of health. In the real world, this abrupt change in tune can mean resorting to less effective or more expensive medications. It can mean delays in treatment, causing patients to lose precious time in their fight against illness. In severe cases, it can even lead to rationing of life-saving drugs. For patients, the impact of drug shortages can be likened to an unexpected encore at a concert. They've come prepared for the scheduled performance, knowing what to expect. But when the encore comes, it's a surprise. They may not know the song, they may not have the energy to keep dancing, and it may not resonate with them the way the original set list did. In healthcare terms, patients might find themselves facing unexpected side effects from substitute medications, increased financial burden due to higher-priced alternatives, or even worse, a halt in their treatment. And let's not forget the ripple effect on the healthcare system as a whole. Hospitals and pharmacies are like the stage crew, working tirelessly behind the scenes to ensure the show goes on, despite the challenges. Drug shortages can lead to increased operational costs, with staff spending valuable time tracking down alternative suppliers or negotiating prices. But just as music fans stay updated on their favorite bands' tour dates, it's essential for healthcare providers and patients to stay informed about prescription availability. This knowledge allows them to prepare for potential disruptions, to adjust their dance steps in time with the changing rhythm. So, while drug shortages may seem like an unexpected encore, a disruption to the rhythm, they don't necessarily mean the music has to stop. With the right information and a proactive approach, healthcare providers can continue to conduct the symphony of patient care, and patients can keep dancing to the tune of health and wellness. Staying in tune with prescription availability is as crucial as following your favorite band's tour dates. After all, in the grand concert of healthcare, everyone deserves to enjoy the music without fearing an abrupt change in tune. Navigating the world of drug shortages is like understanding a complex musical composition. Just as a symphony requires a perfect harmony of different musical notes, the pharmaceutical industry needs a balanced blend of manufacturing, supply chains, and legislative efforts. Let's take a moment to recap our musical journey through the world of pharmaceuticals. We started our orchestra with the drumbeat of manufacturing. The rhythm was disrupted by quality control issues and production delays. Remember the analogy of a band missing its drummer? That's what happens when manufacturing discord hits the pharmaceutical industry. The limited number of manufacturers was another challenge, similar to having only a few music venues. Then we moved on to the melody of supply chains. The global nature of pharmaceutical manufacturing, with 80% of active pharmaceutical ingredient facilities located outside the US, was likened to guitar strings being made in Antarctica. This highlighted the dependency and vulnerability in the supply chain, making it clear that when strings break, the music suffers. Unexpected encores, like the sudden increased demand for certain drugs, were our surprise hit songs. The band wasn't prepared for such a demand, just like the industry often isn't prepared for sudden spikes in drug needs. But there's hope in the harmonizing efforts and legislative lyrics. The FDA, our roadie, ensures that every drug is tuned and ready for the show. It issues guidelines and fast-tracks certain processes to mitigate drug shortages. Legislative efforts like the Mapping America's Pharmaceutical Supply Act are akin to planning a major world tour, ensuring that every pharmacy and hospital is prepared. The direct impact of drug shortages on patients and healthcare providers was compared to a DJ having to switch tracks unexpectedly. Staying informed about prescription availability is as crucial as keeping up with changing tour dates. As we wrap up this musical journey, let's remember that understanding drug shortages is just the beginning. It's our collective responsibility to stay informed and involved, whether we are patients, healthcare providers, or concerned citizens. The situation might be challenging, but with coordinated efforts, we can help mitigate these shortages. In this symphony of health, every note matters. From the drumbeat of manufacturing to the melody of the supply chain and the harmonizing notes of legislative efforts, each component plays a crucial role. When we understand the music, we can better navigate the notes and ensure that the symphony of health continues to play a harmonious melody for all. So whether you're a healthcare professional, a patient, or simply someone interested in the pharmaceutical industry, your role in this orchestra is important. Stay informed, stay involved, and remember, every note matters in this symphony, and together we can ensure a harmonious melody of health.